All right, here we go in 3, 2, 1. What's up, y'all? Welcome to the Sports Medicine Broadcast, a podcast to promote and improve the practice of athletic trainers. Today, I have Dr. Obi Benavidez, and he is talking about opioid abuse in athletics. He's going to share some of his story, his personal experience with athletes and opioid abuse. He's going to talk to some about the signs and symptoms, things to look for, some of the biological ways that it works, and so really just opioid abuse in athletics. So again, we're joined by Dr. Obi Benavidez here on the Sports Medicine Broadcast. So this one is sportsmedicinebroadcast.com/opioid abuse. And just a little bit about Obi before we get started. He joined the Lamar University Sports Medicine Department in July, where he's responsible for baseball and their drug prevention and education coordination. And then he graduated from UNT, which is University of North Texas. That's the mean green, right, Obi?
Yes, sir.
There you go. Where he earned his degree in kinesiology, a master's degree from Texas Tech, and then a DAT from Temple University just this last May. He's been an athletic trainer for 5 years and also done some blogging for the NATA, and I know he's talked with Alicia Pennington about opioid abuse, so something that's really a big deal for him right now. So without much further ado, we're going to get right to it. Obi, welcome to the Sports Medicine Broadcast.
Thanks for having me. Yeah, there's really a few things that I want to talk about, but all really, relating to opioid abuse. One, just in the setting that I'm in, which is college, but also just how that is relevant to all settings for athletic trainers. And then just, how we can kind of take care of ourselves, on an individual basis. So, some quick stats. I talked about this in my BOC blog, but in a very short amount of time, in just under 20 years, opioid overdose deaths were 5 times higher, or increased. Is a pretty significant increase in such a short amount of time. And then whenever you look at the consumption of certain pain medications, in a smaller window of time, about 10 years, consumption of oxycodone increased by nearly 500%. So, we're seeing that those two are mirroring each other, a huge increase in consumption, and then, unfortunately, an increase in overdose. So, as that relates to...
All right, so real quick,
Yep.
You said opioids and oxycodone.
Yep.
So go ahead and tell me what's the difference there.
Yeah, so, for, again, being athletic trainers, we deal a lot with post-operative cases, and our patients usually get prescribed pain medication. So an opiate, there's opiate and opioid are pretty similar, but an opiate is going to be something that's a little bit more, it's naturally derived from a plant, and that's going to be something like morphine. And then an opiate is more of a broad term, and a little bit, it's more of your man-made or synthetic drugs. So, things like, Norco is pretty common post-operatively. So, things like that. But again, all pain medication. So, and these drugs are really effective for pain, which is great, right? So they're really going to reduce the pain signal and perception, but there is a euphoria or a high that people get with taking that. So that's kind of the dangerous part. And then the other component with pain medication is that there are components that act on certain parts of the brain that control the breathing. So you can get, if you have too much, you can suppress your breathing, which is obviously not good. And then, I did, there are a little bit different terms as far as, we talk about addiction, abuse, overdose, and misuse, and there are some differences there as well. So whenever we talk about addiction, that's going to be something that's chronic, that is a condition that's, physical dependence on something. And so whenever your body doesn't have that, you then have, you go through your withdrawal, so you do have actual symptoms with that, where misuse is something where you're maybe taking a medication without a prescription, or taking a medication that's not yours, or taking it longer than instructed or more than your physician has instructed you to do so. And then when we look at abuse, that is taking a drug for a desirable effect, whether that's psychological or physiological. There's going to be some differences within those three, but they're all pretty similar.
Okay, so let's talk about kind of your story and why this became important to you, and then we'll talk about what it looks like for the athletic trainer.
Sure. In March of 2018, we're getting ready for spring ball, which is, pretty hectic, but we had a student athlete who I was very close with. He died of an accidental overdose. He got a pill from someone that he trusted, and it turned out to not be that. It was something that was laced with carfentanil, which is a synthetic opioid, and is actually 10,000 times more potent than morphine. So definitely lethal. And we're seeing that in the U.S. kind of everywhere. People are these drugs are being made in different parts of the world and sent to the U.S. and people are taking things that they're not intentionally, or they're taking things they're not meaning to, and unfortunately it's having pretty bad results. But after that happened, I really wanted to do something about it. Do my part and spread a message and hopefully reduce the amount of deaths related to opioids. So and then for athletic trainers, just really raising awareness on what are we doing to prevent this, and just having a better understanding of what's out there. So
the pill that your athlete received, was it like illegal, or was it something that they had got from a pharmacy?
So it was not. It was purchased off. I guess again a friend or who we thought was a friend, and it was given to him as a pain medication. Just hey, this is oxycodone, and it was made with carfentanil, which is again very lethal, even to the touch. So he bought it as what he thought was a pain pill, a prescription pain medication, but it wasn't. So not technically, not illegal from what he believed it was, but illegal as to how the transaction, I guess, happened. So and how that medication was obtained by that individual who sold it to him.
And so that one pill was what did it, or
yes. Yeah, so the one pill, again, just because of the carfentanil and how strong it is, it's measured in micrograms, so it can go through the pores of the skin. So, when they do raids and that type of thing, people wear gloves just so it doesn't absorb into the skin because it's that lethal. So, yeah, very, 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 very strong drug.
All right. So it's good. Kind of continue talking about what we need to know, or what does that look like in athletics?
Sure. There's a few different things, and from a college standpoint, we do have NCAA drug testing, and institutional drug testing. Most places have that, and I think through drug testing at the institutional level, you can really catch these things pretty early on if someone does maybe have an issue where they are taking pain medication that, one, they're not prescribed, or more often than they should be taking it. So, there are ways to do that. As far as the panels for drug testing, increasing those panels to where you're actually, you're testing for, right now it's, PEDs, marijuana is a huge one, cocaine, but a lot of the panels don't include things that you would find in pain medication. So by adding that panel, I think you'd be able to catch a lot more before it's too late. And, I don't want to, put a target on my back with NCAA, but right now their aim is to prevent drug use, but from a performance standpoint. So, the NCAA primarily tests for PEDs, which does obviously have bad effects long term as well. But I think if we were to change our mindset and say, okay, we need to look at the whole picture, total health care of the athlete, and include things like pain medications in that panel, I think that would benefit a lot of people. And there is going to be a cost associated with that, but with I don't think you can necessarily put a price tag on someone's health and someone's life. So that'd definitely be one way that I think the NCAA and institutions can help prevent this epidemic that we have here.
I know here in Texas we had steroid testing at the high school, so like they'd kind of like randomly select schools and randomly select athletes, and did that for a few years. And there's such a small number, like I think they didn't even catch anybody, for a year or so, using steroids in the high school setting. And so that's one of the questions that people are like, well, why don't they test for recreational drugs instead? Because then you can get like an idea of what's going on. And so again, it's what's your focus? Are you just trying to make sure that the field is level, that we're not giving steroids, or is it that you're trying to test for drugs? And it sounds like they're really just trying to make sure that the field is level, that they're not taking steroids, rather than the overall health of the athlete, which again, it's tricky. Is like, how much do you monitor? They're adults. And
absolutely. Yeah. I mean, I think, trying to take away from more of the punitive, if you test positive for whatever drug, you're going to miss X amount of games. I think maybe, again, kind of switching our focus to, we want to make sure that we're taking care of you, and your overall wellness. I think it should be, in my opinion, should be the approach. And then with the institutional drug testing, and with NCAA, if we were to add a different panel, which would include pain medication, ideally there would be a medical waiver, just like there is with ADHD. If you pop positive for this, you do have to have proof of a diagnosis from a physician. The same would apply for someone that had surgery maybe 2 weeks ago and they were randomly selected. They are going to test positive, obviously, but if someone is selected and they had surgery 5 months ago and there's still traces of the drug in their system, then obviously we have a problem. So that would be the approach that I would like to take. And at Lamar, we are very fortunate that we are have a very supportive athletic director, and been able to implement some new things into our drug testing policy. So I'm really excited that we've been able to do that.
So you just mentioned like 2 weeks post-surgery, you could expect to still see some traces. 5 months, you shouldn't expect to. So obviously speaking generalities here, how long is an opioid or opiate generally prescribed for? And then how long from your last pill does that remain in you?
Sure. So as far as the panel goes and I guess it's how you're testing. So a hair follicle test is going to go back months. Saliva is usually, I want to say, like a 72-hour. It's not very long as far as what they're testing for. And then urine, I want to say, has like about a 30-day. 30-day, I guess you can go back 30 days. But every drug is going to be a little bit different as far as how long it stays in your system. So I don't have an exact answer as to it stays in your system for 14 days. But with that testing, again, if someone did have a surgery 5 months ago, typically they get 2 weeks supplies, if that, and rarely do they get a refill. So all of that would be logged, and we would go back to the physician and get records. And ideally, we would track some of that ourselves as far as an institution goes. So I would know that John Doe got prescribed this many pills, did not get a refill. Have the exact drug and the physician, the procedure, and all that logged. And then so if he did test positive in 5 months, there would be, that would be an indication that he was either getting it illegally or maybe hoarded his pills or her pills, or was going to other providers to get pain medication.
Yeah, obviously, like I said, we're speaking in generalities there, but
Sure.
It's interesting just to think that 2 weeks ago I could have taken a pain medicine and still test positive. And so in doing that, have you looked at the testing? Like, can they test the the volume, I guess, or the concentration that's in the.
Yeah. So, and I know there are institutions that do that. So, just depending on where you're at, or what kind of program you're in, or what kind of program you want to establish, you can do tests. Okay, we're going to test you, or maybe not tell them, but in a week, and see if the concentration has changed. So that they are making adjustments to whatever drug they were doing.
Interesting.
Yep.
All right. So looking at the secondary setting for a high school, so realistically, I should expect, I have a kid having surgery tomorrow, and if he's prescribed pain medicine, he's a adolescent, he shouldn't be able to get any refills. But realistically, hopefully, the doctor is only giving him that one
Right.
2-week set of pain pills, if that. And then, so realistically, after that 2 weeks, he should be done with opioids. What am I looking at for that athlete to see if something is off?
Yeah. Pupils are going to be a huge thing. Sometimes they won't, I guess, respond the same. They might complain of constipation, or they might have nausea, have kind of a tired look on their face, not show up to things. The other thing to look out for is sometimes people that do develop problems start requesting certain medication by name and dosage. So that's going to be a huge red flag if someone comes to your clinic and asks for if they can get a refill on X medication at this dosage. Even young kids, you don't expect that, but that does happen. And that's actually one of the risk factors for addiction and abuse is people that are prescribed pain medication earlier in life have a higher risk of developing an addiction. So whether that's a question in your PPE or just talking to your student athlete, getting that information, I think can help you identify who may or may not have a problem.
All right. So kind of continue. I know we mentioned some about like the makeup of the opioids, opiates.
Sure.
I know you said you're going to cover some of the biology of how those work. Are you ready to go into those?
Yes. Or well, actually, if we can, I was just going to kind of go more. I have some points. I think.
All right. Well, let's do that.
Yeah. So the other one is going to be huge. Is really, and more of a prevention, is going to be education. And as athletic trainers, we do see these students every day for the most part, and having that patient education is going to be huge. Surgeons and other providers do typically provide their patients with some sort of home care instructions and the side effects associated with with their pain medication. But I think if we also develop our own policies and practices as far as pain medication goes, I think we're going to be able to assure a safe and effective post-operative pain control plan for our student athletes. So, I know in the secondary setting, as far as going to appointments with student athletes, I know that's not typically going to happen. But once they come in following their surgery, ideally with their parents, giving your own kind of spiel on what to expect post-operatively and how to properly take the pain medication, I think is gonna help prevent some of those problems. So just patient education is going to be huge.
All right. So on that, to everybody listening, if you have some sort of patient education plan for post-op surgery, like for the pain, send that to me, or just send me like a Facebook message, email, or something like that, because I want to see that and share that and put that. So I'll put that as an example in the show notes. So if you have that, send that to us, and then that way we can kind of look over it and see what he thinks, and then we can post it on there, the example, and maybe some of these are the things that can change. So if you have some sort of home pain control plan or like post-op pamphlet that you would give to your athletes, then send that over to us. So go ahead.
Yeah, no, and I know in the secondary setting it gets a little tricky because you are dealing with minors, but I think having the parent there is going to make a huge difference as well. Just there are adults that don't really know what to expect post-operatively, and establishing real goals for both the patient and their parent is important, and realistic ones when it relates to pain. pain medication isn't necessarily made to alleviate all pain. It's given to you to be functional. And I think that's going to be, I think that should be a message that's given to people, is everyone expects to be 100% pain free, and that's just not the case, unfortunately. And just letting them know that there is going to be a level of discomfort, which is normal. And I know parents, don't like to see their children in pain or, and any discomfort, but that's kind of how things work. So, coming up with a plan even before surgery, I think, or having that talk before procedure is going to be helpful. And then the other thing too, as far as education goes, is disposal of medication and proper disposal. And I think I sent you a link, but the Drug Enforcement Agency, their website gives a link, and you can find disposals for your medication, so you're not just hanging on to those. There's been quite a few studies, but one in particular showed that 33% of only 33% of your pills are consumed. So that's a huge number of pills that are left over, and people just hang on to those. And so when you do that and you don't dispose of them, you just have a large number of pills kind of in your hands, and that's how okay, well, I'm going to give one to my friend because their back hurts, or I'm just going to take this when when my back hurts, or take this before or after competition. That's where we start seeing the misuse and the abuse come in.
Yeah, I mean, even here in the secondary setting, I'm like, I'll get a kid, I took a pain pill or something like that, and I don't go into all the details because usually they don't know. They just got it from their mom or whatever. Yeah, well, I had a pain pill. And it could have been ibuprofen or Tylenol, sure, but it could have been a prescription medicine that they've had. And it's a huge deal there. So just holding on to it makes you more likely to use it or give it away to somebody when it's not their prescription. And that's like your friend, that's really dangerous. So.
Yeah, absolutely. And, I think people just do have that kind of mindset as far as, even price goes, like, oh, well, I don't want to have to pay for this again, so I'm going to hold on to it. And again, you're just kind of hoarding 70% of the pills that you got for a different time, and that's again kind of putting yourself in a bad situation. But that website is great. Usually Walgreens or CVS also have like boxes when you walk into the pharmacy that you can go and dispose of pills properly. So I would highly recommend that for all athletic trainers, especially in the secondary setting, just it's easy to log into and show someone where to go. And the other thing, so one of the other points is kind of a monitoring program, and I think this can be done really at any level. I know the athletic trainers in high school, you have quite a bit of patience, especially in the larger high schools, but as far as like logging, what someone, what procedure they had or what medication they were taking, and maybe just having a patient interview, say, hey, in a week I want to follow up with you. How many how many pills do you have? Okay, you have this many. Are you taking them? No. Okay, well, maybe it's time that we dispose of them. And from kind of a global level, there are drug monitoring programs in effect across the U.S., and it's a database that just tracks prescription medication. So it gives a provider and the patient and how many times they've had refills and on what drugs. And following this implementation in New York, there was a 75% reduction in patients seeing multiple prescribers to get pain medication. So we are seeing that is an effective tool to bring down those numbers.
So you talked about the 1 week follow-up and to discuss the number of pills. So in taking the AT's care course, that's one of the things that I've learned and I've been able to do is to kind of step into a situation, because that's not really a conversation that we're trained to have, and it can be a very difficult conversation. Hey, I'm going to follow up with you in a week. I'm going to ask you about this. I'm going to ask you about these pain pills, and we're going to kind of come up with a plan. And so going through that course, like, it just enabled me to feel more comfortable with asking those tougher questions and
Absolutely.
Stepping into a situation rather than just saying, oh, I hope he's doing the right thing. And just so being more proactive. So I really like that. I know it doesn't specifically apply here, but just having that ability or that skill set to step in and say, this is what we need to do. Tell me about what you're feeling, experiencing. Let's make a plan together.
Sure.
And go forward from there. So.
Yeah, I mean, I think once you start implementing things like that, it becomes a lot more normal. You know what I mean? These athletes talk to each other, and I think once they see, okay, someone's doing this, it's not going to be so strange that you know you have this conversation with me whenever I have or if I have a surgery. So kind of, I think implementing early is going to help everybody out. And then when we talk about identification of possible seekers or abusers, we spend so much time with our student athletes that we typically know what kind of person they are, and if you see changes in their behavior, especially following a procedure, I think having, like you said, a conversation with them, while it may be uncomfortable, could possibly save their lives. So whenever you talk to your student athletes, and even if it's just a casual conversation, there are going to be behaviors that would be a red flag. So anything from failing to comply with their regimen, or if they are losing their pain medications, those are going to all be red flags. And maybe maybe have a chat with them or their provider and see what's going on. And with athletes, we know that they get started on what they call pain medication pretty early. So like you said, ibuprofen, Tylenol, they get started on those pretty early. So maybe having the conversation with them about using proper terminology, I think will, Tylenol, yes, while it is a painkiller, you're not taking a pain medication. So I think just educating them on that too is helpful. And I know we talked a little bit about.
So on that, do you have a good resource where it might say like a poster or a printout or something like that? I mean, I would think that maybe on the government website, whatever it is, that they would have some sort of chart saying pain pills, not pain pills, or addictive, not addictive, that kind of thing. I mean, I know you're working with Lamar baseball,
sure.
And whenever I was at Houston Baptist, basically like the players, all right, well, can you give me 2 packets of ibuprofen before every practice, that kind of thing. And so they become like addicted out of habit rather than addicted out of like physiologically.
Sure. Yeah. That's a great idea. Honestly, I don't, right now, the posters that are really out are kind of the NCAA banned. Again, the ban list, which is, again, your stimulants, your PEDs. But I think that's a great idea. And, right now, what I'm trying to work on is just implementing an education program, maybe twice a year for all student athletes, with various topics. So that would be one of them, because like you said, they do get used to taking certain medication, and it's kind of just like a ritual for them, especially with certain sports. Whether it has a true effect at a certain point, probably not. But I've had that conversation with student athletes too. There is a ceiling effect where you can take all that ibuprofen you want, and it's going to have the same effect from a pain standpoint. The more you take isn't necessarily going to help lessen the pain. So I mean, I like to have just kind of general conversations with them. I think one-on-one is pretty effective, and I know we don't have time to necessarily do one-on-one with everybody. But if you have that student athlete that is coming to you for, I take ibuprofen every day, or I've always done this, maybe having that conversation with them and talking about, how the drug works. Like, yes, you can take 12 of these, but your pain level is probably going to be the same. You're going to have other systemic effects that aren't great.
So in that same kind of line of thought there, do you think taking the ibuprofen regularly makes it easier for someone to say, well, let me just take a stronger painkiller and a stronger painkiller, and then like getting into opioids? Do you think that builds that habit that makes it more likely?
Yeah, and I've read a few pretty interesting articles on kind of the athletic, or the athlete mindset, and they do these things for performance. They want to feel good, they don't want to feel pain, and that's not necessarily just with competition, but that may be with conditioning or lifting. And to me, that would definitely be a red flag if someone is doing this out of habit, for a performance reason. I think for me, that would be an indication to have a conversation with them as far as what they may be taking in the future or what they've taken in the past. And again, a couple of uncomfortable minutes could save someone's life and their future.
All right, so we have people watching live. DJ Gilland and Jamie DeRollo.
Oh, nice.
They shouted out to you saying, hey, I know Don Stuckey, Stacey Avner, David McDonald. They're all checking checking live. So appreciate any of the questions you guys have whenever we're going live. And if you specifically have questions, that's what we're doing here on the Sports Medicine Broadcast, helping to answer your questions in a way that you understand them. So send them that way on Facebook, or obviously we'll give you contact information at the end for getting a hold of Dr. Benavides here. But we're going to continue on talking about opioid abuse and athletics.
I mean, for those in the secondary or, any other setting aside from college, I mean, if any sort of recommendations or if y'all have anything that you've done that's worked, please feel free to share. We can always, improve what we currently have. So I know we did talk a little bit about more of the biological stuff, and just knowing, I guess the side effects of pain medication is going to be super helpful for us. So, that's going to include, constipation, nausea, vomiting, dry mouth, sleepiness, dizziness, confusion, depression, itching, which would usually kind of, you see that with morphine, sweating, and then just low testosterone levels actually can be a side effect of narcotics. So, we know our student athletes pretty well. So if we kind of see some of these things occurring, having a chat with them would definitely be an indication. So,
and then, so like if I take NyQuil, like I think it's 30 milliliters, something like that. You're supposed to take like the cup. Usually I'll take like half of it, and then I add water to the other half, or I'll take even less than half. And it, like if I take a full cup, I'm drowsy the whole day. And so is there like a normal there, like people who take pain medicines more often are less affected, or is it just because of the body? I mean, I'm 6'1", 220 pounds. So you would think that I should be able to take NyQuil, or like one time when I took a Valium for a surgery, like I was walking sideways, right? Like the nurse literally had to walk beside me. Is there something like that maybe body type that would be a possible indicator as well?
I think when you do have someone that is maybe addicted and taking these regularly, they are looking for the next high, if you will. And those effects are, they're eventually going to start not having those same effects. So that's where they're going to go to something a little bit more, something stronger, or a different route to take that medication. But as far as, how it affects, I've seen, I've kind of seen a wide range of people that, like you said, pretty sensitive to a pain medication. If I take something, I usually get pretty drowsy very quickly, but I've, had other patients that are a lot smaller than me, and do just fine with it. They don't get any of the side effects. And then I think that's going to just be really an individual, kind of tolerance for the pain medication. But if we do kind of notice some of these things that are lasting a little bit longer, than what they were prescribed, and, again, red flag for me. So.
All right. So again, coming back to the itchy, dry mouth, the nausea, the
Yep.
avoiding public situations or whatever, constipation, pupils are off, requesting medication by name and dosage.
Absolutely.
So, all right.
Yeah. Let's see. And then the other thing, as far as treatment, this is really related to overdose. We're going to typically see this with, again, the people that are addicted, and generally not going to be with our patient population, but you never know. In 2016, President Obama signed into law the Comprehensive Addiction and Recovery Act, and that gave federal funds to states to do training for naloxone or Narcan, which is kind of reverses the effects of opioid overdose. And you can, I know in Houston, you can go to city health department, and they do free training for that. So I think just having that in your training for in general, I think is helpful, because this can happen anywhere. It can be at the airport, and something like this happens, or just out on the street, and you see someone that is has overdosed. And so I think just having that training in general is helpful. But it, again, people offer it for free. Usually it's a nasal spray. I think it's like 4 milligrams is the average dose, and that just reverses the effects of the opioid. So usually they're not breathing, and once you kind of spray that into their nose. It takes a few seconds, but they kind of just come back to life. So that was definitely a great policy that President Obama signed in.
So I know that paramedics, EMTs,
Yes.
the ambulance drivers, they deal with that stuff, Narcan. And so if you go to the city health department and get the free training, is Narcan something that I could keep here on campus in a secondary school? It may obviously it would depend on the district policy, that
Right.
kind of thing. But then if I do that, I'm still calling 911 or have already called 911?
Yeah, so that is just because we don't know, one, what drug they took exactly and how much. That is literally just to kind of get them awake and responsive again until they can get advanced care. Paramedics they can do multiple shots, if you will, injections. But again, they still need to get to the hospital ASAP. So that wouldn't be something that we'd spray once and they'd be good to go. They would definitely need to get advanced care.
So I know police officers would have it with them here on
Yep.
campus, but do you have any idea about public high school policy for that?
I do not. I think I've heard of a few people that are starting to put it into like their AED kits, just like they are with the Stop the Bleed stuff. So just, I know every district is going to be different. And I know state laws, not every state, I think allows athletic trainers to have that. So that's something that you definitely need to look up, to make sure that you're following your state laws.
All right.
Let's see here. I think that's kind of what I had. And again, if anyone had anything else that they'd like to add, those are really the things I had planned for today. Just, institutional drug testing or some sort of policy to help, identify students that may be addicted or misusing these drugs. Education, again, is going to really be at the forefront for preventing a lot of, our overdoses and abuse. Monitoring programs are huge. And I want to say that a physician can elect someone to be a part of the drug monitoring program. It does not, from my understanding, it does not necessarily have to be a physician. So if you work with a physician or if you work in a hospital system, I think you can serve as someone that is able to check into the drug monitoring program, so you can kind of check your patients and see, if they're going to different providers to get a pain medication. And then identification, again, just knowing, the signs and symptoms associated with overdose, and knowing those who might be at risk for abuse. And then treatment, as far as the Narcan goes, if your state allows it, I would highly recommend it. Again, usually classes are free, and I think there's even some online training that you can do that's totally free.
All right, and so the education here is going to be huge because, as Obi shared, that he had an athlete that one time took a pill that wasn't his, and that one pill ended his athlete's life. And so just educating them, don't take pills that aren't yours if they're not prescribed to you, and especially if they're not from a legit pharmacy. Don't take those medicines because you never know if it's tainted with anything. And just having those conversations, being willing to step in. And again, I mentioned the AT's care program that helps teach you how to have those critical conversations, those harder conversations, and just being willing to step into the situation, and allowing the patient to kind of see the light, or to formulate their own opinion and move forward there in a way that you want them to. So it's a really good plan as well. So educating, and like we said, if you have a plan for dealing with the pain for patients after surgery, then send that to us because we want to see it. We want to share it. I want to put it on the link to this podcast there. So anything else you feel like we didn't cover we need to go over again?
I would actually, just kind of piggyback off what you were saying as far as AT's care. If you haven't heard of them, I think, again, I provided a link, but definitely check out the website. The training is great. They have an individual and they have a group training, and you can just use that really in your everyday conversation with your student athletes or even coaches. But from, someone that's experienced the AT's care, it's probably the best program that the NETA has developed, and you know, having someone to talk to about something that's catastrophic or devastating is really helpful. Not it's easier to talk to someone that knows your schedule and knows what you have to do every day. So definitely use them. They're a great resource.
And after taking the course, I've seen several people posting about like mental health plans, and most of those people were like at universities, because you have like a staff for that, and
Sure.
the more of a one-on-one interaction than you might have here at a high school where you have like 20-on-1 all the time kind of thing.
Absolutely.
What does that look like for you at Lamar, or is that something you guys are working on?
Yeah, so we are actually we are working on our mental health policy, and student health there does have they do have counselors on staff for students, but I think from our standpoint as as athletic trainers, always having that resource for yourself is nice too. And some places do offer that through the university or through the district, but just knowing what's available to you is huge, and AT's Care is one of them. So that's just one organization that I know is extremely helpful.
All right, any other thoughts?
No, we've said it a few times, but we know our athletes pretty well, and we see them every day. We see them more than their family does sometimes. So a few minutes of an uncomfortable conversation can save their life. So just remember that.
All right, so again, the people checking in live, I know Andy and Toki just checked in there. Thanks for joining us. Also, my new coworker Sophia walked in, so she can be part of it. So hopefully we'll be hearing from her soon. She actually worked under Obi when she was a student at the University of Houston. So Patrick O'Haver has been working on the show notes for me, typing those up. So if you want to help type up show notes, then that's something we could really use help with. The better the notes that I have on there, the easier it is for you to find. So like everything that Obi said today, if we have that in a blog post, you can either listen to it, watch it, or just read and find the answer that you're looking for. And it just helps the athletic trainers, helps us improve our practice, and may allow us to find that answer in 2 minutes rather than, this is a 45, 50-minute podcast, something like that. So if you are interested in listening, or if you listen and you want to, take notes, then, let me know, and I can put you on as part of the team and adding in those show notes there. So thanks, Patrick, for doing that and just being willing to do that. So, Obi, what's the best way for somebody to get a hold of you?
Yes, you can reach me by email. It's obenavidesii@lamar.edu. That's going to be the easiest way to get a hold of me.
What's the II?
I'm the second, and that's how.
Gotcha.
Yep. Very confusing, I know, but that's how they do it. So.
All right. So again, this is sportsmedicinebroadcast.com/opioid abuse. So I'll have links to those, the links that Obi shared, and the resources for AT's Cares, the Drug Enforcement Agency, their website there. Reach out, talk to your physician, have a plan, create those, share those with